Hello, everybody. My name is Eeva Ollila. I'm sorry I can't be with you there in the same room, but thank you for giving me the opportunity to talk to you anyway. I'm sure that you have had a very productive and interesting conference, and hopefully I can contribute a little bit with my presentation. So I was asked to talk about alcohol and cancer and awareness of the fact that alcohol causes cancer and what we should do about that. First of all, we all know that alcohol consumption, especially in Europe, is very high, and especially in Eastern Europe. And in the Nordic countries, where it used to be relatively low, it has increased during the last 5 decades very markedly. And today, consumption also in Nordic countries is relatively high. The alcohol share of the total burden of disease is globally very high, and it's especially high in Europe. And in Europe, especially high in the eastern parts of Europe. WHO has estimated that even 13% of European deaths are linked to alcohol. As regards cancers, about 3 to 5% of all cancers are, according to the WHO's estimate, linked to alcohol. In Europe, 10% of the cancers in males are estimated to be linked to alcohol, and 3% of cancers in females. So the problem is real and serious. However, there is very little awareness of the fact that alcohol causes cancer. For instance, in Finland, less than 4 out of 10 would agree with the statement that alcohol use increases the risk of cancer. And the situation is similar in the other Nordic countries. So it's easy to conclude that we need to think about this situation and see what needs to be done. And in the following, I will shortly go through some ideas about why and with whom and how to discuss the linkages between alcohol and cancer. First of all, the first why is very obvious. Alcohol is an important risk factor for cancers. And if we look at the upper digestive tract cancers, 40% of those in males are linked to alcohol, and 25% in females in that region are linked to alcohol. When we look at all the cancers that relate to alcohol, 60% of alcohol-related cancers in males are in that upper digestive tract. In females, where breast cancer is very common, even if only 5% of all breast cancers are linked to alcohol, when we look at all the cancers in females linked to alcohol, 60% of them are breast cancers. And this is, of course, because it's so common in females. So the first why to discuss alcohol and cancer is very obvious. It's because it is such an important risk factor. Alcohol is also an important argument in alcohol policy discussions for other reasons. First of all, alcohol as an argument is usually cancer as an argument is usually taken very seriously because cancer is regarded as a very serious disease. So when you mention cancer, people usually take this seriously. Thirdly, with cancer, we don't have the discussion of the J curve. Even if we think that the J curve, meaning that a little bit of alcohol is healthier than not alcohol at all, even if we think it's an artifact, most likely, it's been discussed for decades and it has blurred the discussion on the harmful effects of alcohol on health. And with cancer, we don't have that. It's been clearly shown regarding breast cancer that even very little alcohol consumption increases the risk of breast cancer, and even if that's best shown related to breast cancer, it is not limited to breast cancers alone, but is linked, for instance, also with colon cancer. So from my point of view, I'm saying that for three important reasons, we need to discuss alcohol and cancer, because it's an important risk factor, because alcohol's effects on cancer are taken seriously, and because we don't have to discuss the J curve related to alcohol and cancer. With whom to discuss alcohol and cancer is another issue. It's important that the population knows. People know what kind of risk alcohol causes them as regards many NCDs, but especially in this context we are now discussing cancer. It's very important, but it's also very important that we pay attention to policymakers and think about how we can communicate these issues with policymakers, and that we identify the points in time where it is most important to discuss alcohol-related harm with policymakers, so that we make sure that the policymakers, first of all, know the risks, and that when discussing more widely in the population, that the policymakers have the support of the population for changes in policies that diminish alcohol consumption in the population. And we know very well that the availability of alcohol, the price of alcohol, the information available on alcohol, including alcohol advertisements, are key to the consumption levels. You can see that very easily in this picture from Finland, where relaxing alcohol laws in terms of increasing availability increase the consumption tremendously, and when taxes are increased, the increase levels, or even there is some decrease. And again, when some relaxation is made, there's an increase, and then when we increase taxes, there's a decrease. So it's very, very obvious that in policy making we can make a difference in the consumption. At the moment, we have tremendously important policy opportunities within the Europe's Beating Cancer Plan that we should actually take quite seriously. There are discussions, for instance, concerning the taxation of alcohol, implementing the audiovisual media service directive provisions, on the commercial communications for alcohol beverages, and improving the labeling of alcohol. When the food labels were discussed, alcohol beverages were exempted from the regulations, but now there is discussion that alcohol labeling should be improved in terms of listing the ingredients and the nutritional value on alcohol beverages, as well as including health warnings on the labels. And there, one of the most serious candidates for health warnings is the warning of stating that alcohol causes cancer. And we should try to make the best of this opportunity at the European level, as well as on the opportunities at our national levels when they rise. And there we need to communicate these issues, both with policymakers, but also with the public, so that there is public support for policymakers to make these changes. And then finally, I want to discuss a little bit about communicating about alcohol and cancer on population level, and from a population point of view, and also from the individual point of view. Already discussed a little bit about the population point of view, where it's clear that we need to amend availability, marketing rules, and information and price, so as to lower the consumption of alcohol in the overall population. And there the argument or the fact that alcohol causes cancer is important. But when we discuss these issues or communicate with the population and also with cancer patients, the situation is a bit different, or you need to also consider other issues. First of all, with cancer patients, there are two issues basically. First of all, patients may feel stigma of alcohol if we discuss too straightforwardly about alcohol causing cancer, even in cases where the role of alcohol is not major. I personally had this experience that I had discussed the fact that alcohol is a risk factor for breast cancer in media, without emphasizing that from the individual breast cancers, only 5% is attributable to alcohol. And some individual breast cancer patients felt stigmatized by that media information. So, and well, then another thing is that we should discuss alcohol use within cancer patients, because alcohol is also used as a remedy in different crisis situations, and cancer is not probably an exception. So, but that's a little bit a side remark. But anyway, when we discuss the fact that alcohol causes cancer from the individual cancer patient's point of view, it's also very important that we communicate the fact that for individual cancers, you don't know why an individual got cancer, with perhaps an exception of lung cancer and a heavy smoker. The relationship is very strong. Even lung cancer one can get without smoking, but there is a strong relationship, but with almost anything else, you cannot actually say why an individual got cancer. There's always a big chance, a big role that a chance of fate plays. So when for instance, when I discuss the risk factors, lifestyle risk factors and cancer with media, I always try to somehow make it very evident that we are now discussing risks and not necessarily direct causations. And one of the metaphors that I've used, I think more or less successfully, has been the metaphor of lotteries. Like, we all have this lottery of our life, and we can choose from that lottery, between different lotteries, how many, for instance, cancer in one pot of 100 lottery tickets, how many tickets have cancer. So if we have a healthy lifestyle, there will be a lot less lottery tickets with cancer. But if we have a lifestyle, for instance, smoking, alcohol, and unhealthy foods, and sedentary lifestyle, in that lottery there will be many more cancer tickets. And somehow try to concretize what a risk means, that you can alter your risk, but you can never completely prevent yourself from getting cancer. So I think that is important, that we communicate and that we don't stigmatize the patients. They have, their plate is full already, and we don't need to increase their burden, while we need to inform the public about the risks that they can try to avoid. And also we need to try to see that the society in which we all live is as healthy as possible, and makes our life, healthy life, as easy as possible. Thank you for your attention. That was my presentation.